Hi, everyone. Welcome back. My name is Christina O'Hanley, and I'll be your moderator for this session. Right now, we're on the Royal Canin stage, so please keep an eye on the schedule to find out which stage each session is held at. So it's my pleasure today to introduce Lexi Lee. She is a master's student of science student in applied animal biology at the University of British Columbia's Animal Welfare Program. They're here to talk to you today about the connection between animal shelters and community vulnerability. A primary goal of Lexis's master's work is to use one welfare principles to maintain human-animal bonds and help animal welfare organizations provide equitable services. I'm sure this session is going to inspire a lot of questions, especially for those of you in the audience who work or volunteer in animal shelter settings. Please post all of your questions in the Q&A box and not in the chat box. Remember that all questions are anonymous, and you can upvote any question, even if it isn't your own, by using the upward vote arrow. Questions will be moderated by me at the end, and we'll go through those later. Sorry about my cat. Alexis, welcome to the screen.
Thank you so much, Christina, and no worries about the cat. I'm sure everybody appreciates it. And thank you so much for the introduction. I'm so happy to be speaking with everyone today. My name is Alexis. I am a grad student at the University of British Columbia, which is located on the traditional, ancestral, and unceded territory of the Musqueam people. As well, the data that I'm presenting today is taken from animal shelters all across British Columbia, which is not only the territory of the Coast Salish people, but also of many diverse Indigenous peoples. So I do recognize my privilege in being able to do work and do research on this land. And today I'm going to be sharing with you some of our recent work looking at animal shelter services and community vulnerability. Animal shelters might have traditionally been thought of as temporary homes for animals, but many now realize and recognize that animal shelters interact with humans and animals in their communities in super diverse ways. But in many cases, we might not know the types of individuals or the communities that our services are actually being provided to. And very importantly, knowing this might help us understand whether or not our services are equitable and what ways animal shelters can improve the equity of their services such that those who are in need of these services are actually able to access them. And so by looking at this relationship between animal shelter services and community vulnerability, we can begin to try to understand this provocative and a semi-rhetorical question of whether or not animal shelters are taking from the poor and giving to the rich. So before we get into the data, the work that I'm sharing today, as well as the work that I aim to do throughout my grad studies, is ultimately guided by the principles of One Welfare. I do know that many of you are familiar with this concept, and I'm so thrilled to see that so many of the sessions at this year's Humane Canada conference do tackle a wide range of One Welfare topics that range from wildlife to farmed animals to companion animals. And so One Welfare is just this extension of the One Health concept, which many of you might also be familiar with. One Health being the interconnectedness of the health of humans, animals, and the environment. However, One Health mainly focuses on the idea of zoonotic disease transfer between these three facets, whereas One Welfare aims to go beyond the physical health of these facets and instead encapsulates all aspects of welfare, including the environment, your behavior, the affective states. And so generally, One Welfare is the idea that the welfare or the well-being of humans, animals, and the environment are interconnected. And by improving one of these three facets, we may also be able to improve the others. And so, like I said, based on the sessions that you've seen that tackle these One Welfare issues, all aspects of animal welfare, regardless of species or industry, are impacted by human and environmental circumstances. But I do believe that this is particularly true with domesticated animals because it is often the case that humans are responsible for their care, as we can see in the case of animal sheltering and companion animals. As well, as animal shelters exist today, I would argue that they are often quite well suited to implement One Welfare strategies. And this is because, again, animal shelters don't only serve pets, but they often do interact with and serve pet owners, so the humans in their communities. This might be when an owner comes to a shelter to surrender their animal. This could be when prospective owners come and look around to adopt new animals from a shelter. This could also be when a humane officer goes into their community to investigate a cruelty complaint. So all of these are just examples of animal shelters interacting with humans in their communities as well. On top of this, there are already initiatives in place where animal shelters aim to improve human and or animal welfare using these one welfare strategies. And in the animal sheltering community, this can be called community-based interventions. One example of this is low-cost or free spay-neuter clinics. Of course, this aims to alleviate the barrier associated with cost for these surgeries. Another example of this might be pet food banks. At pet food banks, pet owners can receive supplies or food for their animal. And in some cases, pet food banks happen or in conjunction with human food banks. So pet owners are able to receive food for themselves as well as food for their pets. Another example of this is mobile veterinary clinics. Mobile vet clinics aim to alleviate issues with access to vet care that might be due to physical access, so like transportation. In this case, mobile veterinary clinics aim to bring veterinary services to these communities themselves. And then finally, another example of a one welfare community-based intervention is emergency boarding services. So in this case, animal shelters act as temporary homes for animals when the owner might be undergoing some sort of crisis or are otherwise unable to care for their animal for some period of time. So in this case, the main goal of emergency boarding services is to return the animal to their original owner after a temporary boarding. So in all of these programs, they are quite one welfare oriented because they aim to improve the welfare of animals by helping pet owners provide care to animals. So now let's shift a little and start thinking about a potential issue in animal sheltering that deals with one welfare. So one potential issue is that continued pet ownership may not be equal across all people. And to begin to think about this issue, we do have to understand this shift in ideologies that animal shelters have recently gone through, where traditionally animal shelters focused on this idea of responsible pet ownership. As an example, if you had a dog that you had to relinquish to a shelter because it needed ongoing veterinary care that you couldn't afford, you might be labeled or considered an irresponsible pet owner. And in like the worst case scenario, you might have even had difficulties adopting another animal when you tell them that you previously surrendered an animal. This can be harmful because it puts all of the onus for maintaining the human-animal bond and continuing pet ownership on the individual person. And if the individual person, perhaps even due to extenuating circumstances, is unable to care for their animal, they might be considered irresponsible. However, more recently, there's this idea that animal shelter services are instead intrinsically linked to larger systemic issues. And when I say systemic, what we mean is that many of these issues related to companion animal welfare and the welfare of animals in shelters relates to the larger socioeconomic and political systems that exist already in our society. Just to be a bit more specific, you might be familiar with this phrase, the social determinants of health. If anybody has ever read anything about public health, or maybe you've heard of this phrase in relation to COVID-19, social determinants of health are upstream factors, upstream just meaning more macro factors beyond the individual that are found to impact health outcomes. So again, examples are seen here on the slides. They might include education, healthcare access, your home and neighborhood, your socioeconomic status, etc. And just to give you an example of what social determinants of health might look like in the public health side, as an example, if somebody lived in a neighborhood where they had very poor access to grocery stores, so their nearest grocery store was very far away, they might be less likely to have good nutrition. And this in turn would raise their risk of health conditions like diabetes or heart disease. And so to solve this issue, simply promoting healthy food choices wouldn't actually eliminate any of these health disparities completely. But instead, perhaps we could look more towards our upstream decision making. So in this case, maybe we can take a look at their neighborhood and their built environment and say, oh, they don't actually have adequate access to a grocery store in their neighborhood. And so to bring this back to companion animals, it's very likely that these upstream factors don't just impact our health disparities. These are facets that shape virtually every aspect of our society. And so it's very likely that this would extend to the ownership of companion animals as well. So there is already some research that relates some aspects of social determinants, in this case in demographics, to animal ownership. So in this example, previous research does find that pet ownership is just more likely in certain demographics. For example, pet ownership is more likely among high income earners, among homeowners, and among rural residents. There's also other animal shelter research that has considered human-related reasons for surrender. And in many cases, owner-related reasons for surrendering animals are more common than animal-related reasons. And by owner-related reasons, this could include having difficulties finding pet-friendly housing, cost-related issues with owning a pet, major life changes like having a divorce, or perhaps the pet owner having health issues. And so while there has been some initial research looking at some of these human demographic factors and companion animal ownership, we were interested in those who might potentially be vulnerable to lack of continued pet ownership. So whether or not we could do better research to understand these relationships between community level vulnerability and animal shelter services. So we are interested in understanding whether or not continued pet ownership is unequal based on these human social factors. And we're interested in whether or not we could identify these vulnerabilities as well as these communities. And so myself, as well as my supervisor, Dr. Sasha Protopopova, and our colleague, Dr. Amelia Gordon from the BCSPCA, did a series of studies where we connected animal shelter data to Canadian demographic data to better understand this issue. With a province as large and as spread out as BC is, we are very lucky to partner with the BCSPCA for our research. If anybody's unfamiliar, the BCSPCA is a network of 36 shelter locations, which you can see here on the map. And these shelters generally have similar overarching policies, and they do often transfer animals between one another, which makes them quite unique. As well, if you're unfamiliar with the geography of BC, the spread of these shelters are quite reflective of population distribution in the province. So you can see there are quite less people living in the northern areas as well as the interior areas of the province. Whereas in the bottom left corner, you can see there's Metro Vancouver as well as Vancouver Island. And in fact, Metro Vancouver actually houses over 50% of BC's population just in that tiny corner, which is where I am coming from today. In order to measure vulnerability, we use something called the Canadian Index of Multiple Deprivation, or the CIMD. So this is derived from Canadian census data that was collected in 2016, and it uses small units of area called dissemination areas, or DAs. So each dissemination area is relatively geographically stable. It's made up of about 400 to 700 people, and it's the smallest unit that all census data in Canada is actually collected. And so to create the CIMD, researchers used something called a factor analysis, which basically just aggregates indicators of deprivation or vulnerability for each province. So when I show you these 4 aggregate factors from BC, what you're actually looking at is the factors that through the analysis ended up being the most prevalent vulnerabilities in BC. So the first factor is ethnocultural composition. This basically indicates the proportion of racialized population in an area. So this could be the proportion of self-identified visible minorities, those who are foreign-born, those who are linguistically isolated, meaning that they have no knowledge of either of the 2 official languages of Canada, either English or French, and then the proportion of recent immigrants in a dissemination area. Situational vulnerability might be what you more typically think of when you think of the term socioeconomic status. So this would include the proportion of the population in a dissemination area that's low income, those with fewer years of education, but as well, situational vulnerability deals with quite individual variations. So this would include the proportion of single parent families in a dissemination area, those who live in dwellings that need major repairs, and then those who identify as Indigenous. Economic dependency indicates the proportion of the population in a dissemination area that are receiving their income from a non-employment source. So this would include the proportion of population that's over 65 that's receiving their pension, those who are less than 15 who aren't able to participate in the workforce, and then those in between the ages of 15 and 65 that are unemployed versus those who are employed. And then finally, there's residential instability, which deals with various aspects of housing insecurity. So this would include the proportion of apartments that are in the dissemination area, the proportion of people who live alone, those who rent their place versus own it, and then the proportion of people who have moved within the past 5 years. So as you can see, the CIMD is quite interesting as it allows for more exploratory analysis of vulnerabilities across a very wide range of social determinants. And so when we connect it to other data, it can provide us geospatial indicators of vulnerability. So not only are we able to quantify the level of vulnerability that's experienced in these communities, we're also able to see through a map the areas in the province that are experiencing these particular vulnerabilities. So that's why we chose to connect the CIMD to our BCS-BCA data. So in our first study, we were interested in whether community level vulnerability predicted increased risk of surrendering for any particular reason, of surrendering an animal of any particular species or of any breed, or surrendering animals with any particular health status upon surrender. So what we wanted to do is understand the impact of vulnerability within each of these categories, which I will explain now. So what we did is we performed a multinomial logistic regression within each of these categories with the most commonly reported level as the reference category. I'll explain this briefly. So for example, highlighted here is the surrender reasons. So the most commonly reported surrender reason in our data was surrendering for having too many animals, which you see on the left where it says references too many. So what we're looking at here is whether any of the 4 CIMD factors predict increased risk or decreased risk of surrendering for any of the surrender reasons seen on the y-axis in comparison to surrendering for having too many animals. So if any of these points fall along the dotted line, it indicates no increased or decreased risk. So there's no relationship between the CIMD factor and the reason for surrender. And then points to the right of this line indicate that the CIMD scores, increased CIMD scores predict increased risk of surrendering for this reason in comparison to surrendering for having too many animals. And then points to the left of this line indicate the opposite. They indicate decreased risk of surrendering for this reason. So these are the results across all of British Columbia. And what I'm going to do is I'm just going to zoom in on a few so you get a few examples of some of the findings. So one example of the result is that increased residential instability predicted increased risk of surrendering rabbits and small animals in comparison to cats, which are the most commonly surrendered animal. So this map shows the dissemination areas in the city of Vancouver. The darker purple areas are communities with higher vulnerability scores for residential instability, so they're more housing insecure. And then the red and orange points correspond to locations where rabbits and small animals were surrendered from in the city. If you're familiar with Vancouver at all, you'd see that areas with very high residential instability, such as downtown, Olympic Village, where we know that there's a high proportion of apartments and rentals, also do see a high number of surrenders of rabbits and small animals. So what our results indicate here is that certain vulnerabilities might impact the type of animals that people surrender to animal shelters. So if you've ever rented before, like I am right now, you would know that landlords do have control over the type, the number, the size of animals in rental units. However, despite this, there is very little research on how pet-friendly housing policies impact those who have animals, like small animals or rabbits. Oftentimes, even if you're looking at a rental listing online, you'll see that it's not specified whether animals other than dogs or cats are allowed or not. However, despite this, a study of rabbit owners that reported the main stressors of owning a rabbit is indeed housing-related issues, which is similarly found in research about dogs and cats. So perhaps what this finding indicates is that more focus is needed on research in pet-friendly housing regarding other species as well, particularly for communities that might be experiencing or more vulnerable to housing insecurity. Another example of a result from this study is that increased ethnocultural composition predicts increased risk of surrender for all 4 owner-related surrender reasons. So this includes personal issues, which includes things like divorce or having a baby, housing-related issues, cost-related issues, perhaps being unable to afford the animal, and as well human health issues. To relate this back to our social determinants of health, minority and immigrant status has been previously linked to some of these surrender reasons in the public health literature or in the sociology literature. So, for example, Canadians that do identify as ethnic minorities are found to be at a higher risk of various poor physical and mental health outcomes. As well, immigrants to British Columbia often do report difficulties finding housing due to unexpectedly high costs. And a 2014 study found that Vancouver neighborhoods with more homogenous minority populations, so they would be higher in ethnocultural composition, were found to have higher prices. So all of these examples are examples that might possibly put racialized populations at risk of surrendering their animals for owner-related reasons. So with this result, we see that vulnerabilities might impact the reasons why individuals surrender their animals. Another example of a result from this study, we also found that increased situational vulnerability predicted increased risk of a few related issues, including the surrender of puppies, the surrender of kittens, as well as the surrender of animals that are intact upon intake, meaning they're not spayed or neutered. The situational vulnerability factor is a little bit more difficult to tease apart because it is made up of more individual variations in socio-demographic conditions. Again, this can range from your income, or whether or not you live in a dwelling that needs major repair, whether or not there's a high proportion of single-parent families in the neighborhood. But our findings here are congruent with a moderate body of literature that finds a relationship between low-income communities and the surrender of unwanted litters of puppies and kittens to animal shelters. Of course, it's this body of literature that has led to the creation of low-cost spay-neuter clinics. And regarding these clinics, a US study found that the majority of these clients served at low-cost spay-neuter clinics do have an income of less than $30,000. So we can see that currently, existing spay-neuter clinics are largely serving low-income communities. However, our BC data shows that vulnerable communities are still prone to surrendering unwanted litters. So I was only able to talk about a few examples of results in our study, but our study did indeed find that vulnerabilities do impact the reasons why people might surrender their animals to a shelter, the types of animals that they would surrender to a shelter, as well as the health status of these animals upon surrender. But of course, when we're thinking about continued pet ownership, this doesn't necessarily answer our question directly. One potential limitation of this first study is that it really does only look at risk of surrender within each of these categories. So you, as well as myself, might be wondering, what about overall? So how do these proportions of animals differ based on vulnerabilities? So recently, there was a report that was done by Best Friends that looked at rates of intake and adoption in counties in comparison to the nationwide rate, particularly looking at something called the Social Vulnerability Index. So this is something that's quite similar to the CIMD. So it's a measure of vulnerability that looks at some factors like socioeconomic status, race, disability status. And what they found is that not only did high vulnerability counties within the US have a higher rate of intake overall in comparison to nationwide rates, so more animals are coming from these communities, but also that adoptions as a percent of intake are over 10% points lower in high vulnerability areas in comparison to the national rate. So what this indicated was that communities that are connecting with animal shelter services to surrender their animal might not be the same as the communities that are actually adopting these animals from shelters. This definitely related to our interests for our second study. So we were interested in how animals, quote unquote, flow between communities when they're surrendered and then when they're adopted. So instead of comparing to nationwide rates, we directly compared this flow by finding animals that were surrendered by their owners to an animal shelter and then subsequently adopted out to a new home, and then comparing the proportion of animals across quintiles for each of the CIMD factors. We did this across all species, and then we also did this within individual species groups to see whether or not there was any particular species differences. Okay, so on this slide, what we see is a bar plot that shows the proportion of animals that were surrendered from each situational vulnerability quintile. At the top in purple, it shows the proportion of animals that were surrendered from communities with low situational vulnerability. So for this factor, that would mean fewer low-income residents, fewer single-parent families, et cetera. And then as we go down the bar towards the yellow end, the situational vulnerability quintile increases. So this is increasing in vulnerability for this factor. What we see here in yellow is the proportion of animals that were surrendered from a situational vulnerability score of 5, meaning that they have very high vulnerability for this factor. And perhaps in a complete ideal, just world, we might hope that animals are being surrendered relatively equally across these 4 quintiles. So perhaps that each quintile would be responsible for surrendering about 20% of the animals. But unfortunately, looking at this bar, we do see that this is not the case. In fact, we see that over half of these animals are coming from areas with very high situational vulnerability, with a score of either 4 or 5. This again indicates that perhaps income or other socioeconomic factors, perhaps reflected in cost-related issues, are quite prevalent in the decision to surrender an animal to the shelter. And then just to help you understand exactly what we meant by flow, we connected each of these communities that they were surrendered from to communities that animals were adopted out to. And the thickness of each of these flowing bars shows the proportion of each animal that was surrendered from each CIMD quintile and then adopted out to another CIMD quintile. So on the right-hand axis, what we see is the proportion of animals that were adopted out to each of the situational vulnerability quintiles. The first thing to note is that when you take a look at the left-hand bar and the right-hand bar, we see that the proportions are markedly different. But if we just take a look at the right-hand bar, we actually see that animals are adopted out more equally across the 5 situational vulnerability quintiles. This was a little bit surprising to us, but this one potential explanation for this result is that the BCSPCA implemented the Adopters Welcome philosophy in 2014. Again, our data was taken 2016 onwards. Adopters Welcome is a program that was created by the Humane Society of the United States, and it aims to reduce barriers and increase adoptions. And in order to increase adoptions, they suggest that animal shelters remove restrictive adoption practices. So one potential example of restrictive adoption practice is a home visit. So animal shelter staff might visit the potential adopter's home to make sure that the physical environment is appropriate. But of course, doing so might lead to a potential discrimination against those who might be more situationally vulnerable. So they might not live in owned standalone homes. And so rather than these restrictive adoption practices, Adopters Welcome encourages animal shelters to implement conversation-based adoption practices. So here, animal shelter staff will prioritize any conversations that the potential adopter may want to talk about regarding pet adoption and animal care. So perhaps from our previous finding, where we don't actually see disproportionate adoption of animals across situational vulnerability quintiles, this might be due to the BCSPCA removing many of its restrictive adoption practices and instead implementing this conversation-based approach. The differences of surrendered versus adopted animals in the situational vulnerability quintiles was very prominent for puppies and kittens. So here, what we did, just to show you in a little bit of a different way, is we subtracted the outgoing CIMD score from the incoming CIMD score. So this means that the negative numbers seen on the left-hand side of the x-axis indicate that the animal moved from areas of low vulnerability to higher vulnerability. And then the positive numbers mean the opposite. So the animal moved from an area of high vulnerability to low vulnerability. So what you're seeing in these histograms is that for both puppies and kittens, a high proportion of them are moving from communities of very high situational vulnerability to communities with low situational vulnerability. And if I were to say this more colloquially, if I were to say this more colloquially, perhaps I would say that we see that a high proportion are moving from more affluent or richer communities to less affluent or poorer communities. Yes, I will close this window. I think that you can hear some beeping. Thank you. Okay. So again, what we see here with puppies and kittens might relate back to this issue of unwanted litters. So it's important to note that, again, across the province of BC, even though it's so big, like I showed you in the map, there are only actually 2 dedicated spay-neuter clinics. Plus, of course, there are a lot of amazing organizations that partner with community general practices. So perhaps this disproportionate surrender of puppies and kittens from areas of high situational vulnerability may still be due to limited access or limited presence of spay-neuter clinics and programs in highly situationally vulnerable communities. Another possibly surprising finding was that a very high proportion of animals were surrendered from communities with low ethnocultural composition, so they're less vulnerable for this particular factor. And you can see on this left-hand axis that less than 15% of animals are surrendered from communities with a 4 or a 5 in ethnocultural composition. On the other hand, on the right-hand axis, we can see that a high proportion of animals are also adopted out to areas with low ethnocultural composition. This result was surprising, but it may be due to a number of reasons. For example, in BC, there is a very major difference in ethnic composition between rural and urban areas in the province. So the majority of racialized populations and immigrants tend to settle in large urban areas like Metro Vancouver, rather than in the northern or interior areas of the province. Another potential explanation is that this imbalance stems from the overall likelihood to own an animal. So there is some research that finds that white Americans are more likely to own a companion animal in comparison to non-white Americans, for example. Perhaps slightly less palatable, it might also be possible that the procedures of the sheltering system itself might pose barriers to adoption. So even with questions that do remain on, I guess, less restrictive adoption applications, although they aren't directly discriminatory, they still might be subject to differences between cultures. An example of this is that we know that contemporary caretaking behaviors do differ between cultures. So while crating dogs is acceptable and encouraged by Canadian Veterinary Medical Association when dogs are left alone, it is actually not permitted in many countries, like Sweden. So the answers to adoption application questions might be judged more so based on cultural context, even though not directly discriminatory. Even further, perhaps one more explanation for these results is that animal shelters might lack cultural competency. In public health, the term cultural competency aims to improve the accessibility and the effectiveness of healthcare for racialized populations. In healthcare settings, common interventions to improve cultural competency include improving knowledge and attitudes of cultures, as well as increasing diversity in the workplace. I'll give an example. In our study, ethnocultural composition includes linguistic isolation. Again, this means no knowledge of either of the two official languages of Canada. So what our study indicated is that communities that are surrendering and adopting animals are largely white and English or French speaking. So perhaps knowledge of animal shelter services or comfort with using these services might be decreased for those who might be more linguistically diverse. In the public healthcare literature, language barriers do lead to patients having decreased confidence in the care that they're receiving. And even among Canadians who are fluent in English as their second language, are often report discomfort when seeking healthcare services and would prefer and be more comfortable with having services provided in their native language. And so perhaps animal shelters, especially those in linguistically diverse communities, can consider the languages which their services are represented in. And of course, this might be improved by the second point on this slide through more diverse hiring. On this second point, there was a report from the Association for Animal Welfare Advancement that was published on the state of diversity, equity, and inclusion in animal welfare. So this survey was sent out to professionals in companion animal welfare and found that overall, staff feel that there is currently a lack of adequate diversity in animal welfare fields, and that organizations feel that they face barriers to increasing this diversity. Interestingly for us here in Canada, Canadian respondents believed more strongly, so disagreed more when they asked if there was adequate representation in their organizations. So perhaps what we see with the disproportionate adoption outcomes across ethnocultural composition quintiles might indicate the need for increased cultural competency within our shelters. Overall, these results show that the use of animal shelter services is indeed impacted by community level vulnerability. In our particular study, we looked at services like owner surrender and adoption, but like I said, animal shelters do much more than that. So it's quite likely that these services other services might be impacted. So perhaps we can think of things like intake of stray animals, or perhaps even things like disaster response. Another thing to note is that these results are quite location specific. Like I said at the beginning, the BCSPCA is quite unique in that it is a large network of shelters that has a large internal transfer program. And so the results might differ when looking at different communities and as well different shelters. On top of that, the relevant vulnerabilities that are experienced might differ depending on your community. So I use the 2016 CIMD, which was the most recent index available at the time, but it is likely that animal shelter services, as well as the vulnerabilities that are prevalent in our communities, might change over time. So research similar to ours could be used to evaluate community-based interventions by looking at the impact of these interventions before and after they occur. And finally, our studies indicate that understanding community level vulnerability can help inform more equitable animal shelter services. For example, the data in our study could be used to inform location-specific community-based interventions. So in our study, even with the implementation of spay-neuter clinics in our province, we still do see disproportionate surrender of puppies and kittens from very high situationally vulnerable communities. So in this case, our results might indicate that further support or programs might be needed in these communities to reduce the surrender of unwanted litters. Additionally, our methods could help animal shelters evaluate their own adoption practices. Recently, animal shelters are becoming more concerned with their role in perpetuating inequity through their adoption practices. And our study showed that only some types of vulnerabilities are subject to disproportionate adoption outcomes. But I do think that more research is needed here. So for example, in our study, we didn't actually evaluate the proportion of members from these communities that are visiting the shelter or attempting to adopt these animals. So exploring this further could more directly evaluate adoption practices in terms of whether or not our services are equitable. And then finally, a primary goal for animal shelters is to remain at a reasonable capacity through reducing intake and increasing adoption so that they can continue to serve as a safety net for their community members. And so in order to meet this goal, animal shelters have already begun to utilize the One Welfare approach, much like in all of the examples that I gave at the beginning of this presentation. But the results of our study provide further evidence that animal shelters can focus on human support services to help reach this goal so that we can continue to serve both humans and animals. All right, that's it for me. I'm very excited to hear all your questions. It sounds like lots of them are popping up in the chat. Just to say thank you, this research was funded by the Social Sciences and Humanities Research Council. Both of the studies that I talked about today are linked in these QR codes. And if I don't get to your questions for some reason, my contact info is also on this slide.
Okay, sorry about that. Okay, thank you. Thank you so much for this presentation. We do have a ton of questions, so we're going to begin with our question and answer period now. Okay, for the first one, and remember for everyone, if there's a question that's already been written that you were also interested in asking, please upvote it and then I'll answer them in order. And then also continue to provide some questions in the Q&A box and not in the chat. Okay, so our first question, you mentioned that the onus of pet welfare should not entirely be on the pet parent. Who should it be on and how should this be enforced?
Yeah, this is a very common issue in public health as well when we talk about social determinants. I do think that it's very multifaceted because, of course, while we don't want all the onus of the responsibility to maintain pet ownership to be on the pet owners, we can't also expect animal shelters to do this as well. One suggestion to improve this is to be more multidisciplinary when we think about our approach to keeping animals in homes. One great intervention for this is connecting social services, human social services, with animal shelter services directly. So by partnering with these two, not only can we cover a wider range of vulnerabilities that might be experienced by pet owners, but we can make sure that animal shelter services are seen when we're considering issues that might be related to human social services as well. So I do think that while the responsibility should not be solely on the pet owner, there is a lot of work to go forward to be able to connect all of the people that might be required to actually solve some of these issues. Again, like I said, when I was talking about upstream factors, this would be even larger than animal shelter services as well. This would be our governmental structures and our political systems too, which is very difficult as well.
Great, thank you so much. Okay, next question. This person had wrote, in my line of work, I use the phrase, owning an animal is a privilege, not a right. Please provide your thoughts on this attitude.
I do see Amy's comment. Thanks, Amy Morris, for your comment in the chat as well. And so when people ask me about this, I do say that regardless of whether or not we choose to serve our community members, so for example, whether or not we choose to adopt out an animal to a family because they have children, for example, it's quite likely that this family might go and receive these animal services elsewhere. So that maybe they'll go adopt or go to a breeder instead and get a pet. So regardless of whether or not we feel that owning pets is a privilege, this is not necessarily something that is practiced. And so I think that what we need to make sure is that we are providing our services where we can to keep these people and pets together. If that if that helps answer that a little bit.
Great, thank you. Okay, is it true that pet housing rules can rarely be enforced? As much to your knowledge, do you know about this?
This is not my area of expertise. I know that Dr. Taryn Graham and some of the other colleagues are actually doing a talk about this later this month. So I think that if you want more information about pet housing policies, you can definitely go there. But in my understanding, at least in Vancouver, do you mean enforceable as in like legally enforceable?
I believe that it means they mean things like you're not allowed to have pets if you live in this apartment, things like that. And like
Yeah.
what rights to the owner or like to the person who's trying to live there have, and what rights do like the tenants or landlords have.
Mm-hmm. Yeah, so I guess in it depends on the province that you're in as well. So
Mm.
there are some provinces who have laws that say that you can't outright say that you are not allowed to have pets in this unit. Of course, when somebody goes and visits the unit and says, "I have two dogs," that might be a different story of whether or not a landlord would actually choose to rent out to a person, especially with a housing market that's as I guess just not fair as it is right now. So I know that it would depend on the province that you're in terms of whether or not they're actually allowed to upfront say that you're not allowed to have pets in your unit. However, in BC, this is not the case. People are still able to promote that their unit isn't pet friendly, as well as all the other things that usually come with it, like requiring a pet deposit, et cetera, et cetera. I hope that helps to answer a little bit. But again,
Yeah,
I
I
think
think
there's
for
going to
that
be,
it is
we're
it
going to
is
learn a
very
lot more about
it
this
is
week.
very specific to your location.
Mhm.
It's typically a provincial thing, but there are some rights and regulations that landlords have, and that
Definitely.
yeah, that's very different. Um,
Yeah.
but yeah, there is a talk coming up later on in this month during the summit, so you can stay tuned to that if you guys are interested to hear about more about that. Okay, next question. Does locations or access to low-cost spay neuter show that those areas have lower shelter intake in the data? And does this oh, let's just answer that first part.
Sure.
Yeah.
So in my particular study, the things that I didn't look at was actually the types of services that are like, I guess, geographically the types of services that are accessible. So there is other research out there. So recently there was a study that used the information from DC cat count in the United States that looked very directly at animal shelter distances from animal shelters. And found that that did impact the use of their services. In my particular study, I didn't do that, but there are studies previously that have looked at it kind of in like a couple steps. They looked at areas that animals were coming into that had higher intake, so communities that were surrendering their animals more often, and then they implemented some spay neuter services there to see whether or not it improved it. And in some cases, there was like an improvement of intake from these areas. So it has been done previously, and that's a good example of where types of research similar to mine can be used to identify the communities that need the help, provide these services in these communities, and see whether or not they do improve.
Perfect. And then, yeah, the last part of this person's question, does this take into account, as far as you know with this other research,
Mhm.
um, transport or those who don't have a private vehicle? like if there's a walk-in access, mobile, spay neuter, or if there is animal-friendly transport. If you are able to answer that.
I don't think that I know based on the previous research that I've read, but of course, this would be an issue in terms of actually accessing these services. So I think that
Mhm.
along with my study, where we looked at very big, kind of overarching pictures of our community, what's additionally needed is actually asking the community themselves what types of services would be useful for them. So even though my study can say those who experience very high situational vulnerability are likely to surrender their animals. Or their puppies and kittens, for example. What might also be useful is actually going to these communities and asking what types of services or how would these services best be suited to fulfill your needs. So while my study does cover some of these like more macro issues that can begin to help us understand what where these programs would be useful, I do think that there is a second step where we should actually connect with our community members to see whether or not there's additional challenges, like, for example, transport.
Great. Okay. Okay. How do you suggest handling strong cultural or religious views on animals in an effective, respectful way?
This is really tough. I think that from a research perspective, very little is actually known about differences in cultures in terms of companion animals. So, for example, I am Asian Canadian. There is very, very little research on how those who immigrated from Asia and now live in North America feel about things like pet care or animal shelters in general. But I think that what my research showed, at least in this presentation, is that there is at least a discrepancy there. So I think that when we're beginning to try to understand how our community responds when it comes to cultures, I think that we're basically at the base level. We basically don't know anything. So I think that, again, this comes to doing more research and connecting with our community members to actually gather this information before we make any changes to how we practice, for sure, so that we can
And
incorporate them in our plans to improve our shelter services.
exactly. Probably taking multidisciplinary approaches, looking into sociological aspects and things like that.
For sure.
Um, okay. Is there data that supports and shows that shelters that have programs that help animal guardians keep their animals rather than surrender, so for example, training support, have lower relinquishment rates?
Hmm. Off the top of my head, I can't think of anything that really directly looks at this. There is a little bit of research looking at things that might not necessarily help. So, for example, education campaigns where you say like you should take care of your animal these ways have found to be not very effective in terms of return and relinquishment rates. And so, yeah, it's very difficult. So I guess to plug my future research, one example of a potential pet retention intervention is, or not necessarily pet retention, but just reducing the intake of animals to shelters is self-supported rehoming. So through self-supported rehoming, where animal owners can put up their own animal for adoption rather than relinquishing it to a shelter, it actually turns out that quite a few animal owners choose to keep their animals. And so by more closely looking at specific interventions that we believe might actually help with the reduction of intake, I do think that we can develop a better understanding of whether or not these are effective, not only in terms of sheltering, but also for the pet owner and their pets. So again, I do think that there is a lot more research that's needed in this area.
Exactly. Yeah. Um, yeah, I think it is a topic that needs to be researched a little bit more, but it's definitely something that a lot of shelters are currently doing.
Oh yeah, for sure. I think that most recently, because of this kind of whole shift in this idea of just animal services to both like human and animal services, I think that a lot of these programs are honestly just beginning to pop up and be implemented more uniformly across animal shelters. And so I think that there will be a lot of opportunity, and there already has been a lot of interest and opportunity in research looking specifically at interventions that are meant to keep pets in homes.
Exactly. Okay. So you said BCS PCA has lowered restrictive barriers to adoption. Is this still the case? Could you elaborate, please?
Yeah, so the BCSPCA and a lot of shelters in BC have committed to lowering their adoption practice, or lowering the barriers in their adoption practices. The I guess the degree to which animal shelters have done this across BC, even outside the BCSBCA, does vary for sure. And I do think that this does come back to kind of what we feel is an actual direct barrier versus what we feel might be an indirect barrier to discrimination. So for example, a very direct barrier would be saying nobody under 25 can adopt an animal from our shelter. Largely across BC, this has been removed from most animal shelters and rescues. However, like I said previously, there might be other questions that do remain on adoption applications. So for example, that even if they do kind of are the basis for conversation-based adoption approaches. So for example, when somebody asks, would you, if you were given a dog, would you crate the dog while you were away? Like I said during my study, this does kind of differ across even Western societies. And so when somebody sees that and is trying to think of an answer, so what should I put down? What if I've never had a dog before? I don't really know anything about crating. What if they feel that putting down a certain answer might still be wrong? And what if in the shelter staff's eyes, putting down one of the answers, yes or no, to crating your dog might actually still feel wrong for them? So when we're evaluating whether or not we've actually fully removed these barriers to adoption practices, I think it's more than just removing these these very direct restrictive practices, but also taking a look at how potentially our cultural competency, how our personal biases might be affecting the less restrictive adoption practices that we still have in place.
Great, thank you. Okay, the animals that are surrendered from by families in vulnerable situations, did you collect data on where these animals originally came from? So were they often found from friends, adopted from shelters, bought, or purchased?
Unfortunately, we didn't take a look at sourcing. We were just looking at animals that were surrendered, but not where they came from beforehand. So we did not look at that, unfortunately.
Great. Okay, and so in reducing barrier to adoption, do you see not permitting cats to be outdoors, even while even walking it on a leash as a barrier, particularly in urban versus rural?
Mm-hmm.
So do
Yes.
you find letting cats outdoors, do you see that as, if you were to say on the adoption application that it's not
Mhm.
allowed to let your cats roam outdoors, do you think that's a reduction in barrier to adoption? And do you think it being different in rural versus urban communities?
I definitely think that it is different in rural versus urban communities, given the difference in prevalence of outdoor cats between the two areas. I do think that in terms of it acting as a adoption or a barrier to adoption, I do think that it could act as a barrier to adoption because you do have situations where people say, I previously had a cat who lived outside its whole life. It was completely fine. None of the issues that people talk about when they talk about the issues of leaving cats outdoors existed with my pet cat. It lived until it was like 17, whatever. And so actually in the Adopters Welcome Manual by the Humane Society of the United States, they do a pretty good job of discussing what this potential barrier could look like. So one of these kind of approaches could be, again, perhaps explaining to them why animal shelters typically don't allow people to let their cat out outside, as well trying to provide them with the supplies that are needed to adequately keep their animal inside. So what happens if you say instead, oh, you have a really great patio, maybe you could make a catio, and then your cat could hang out indoor, outdoor with your supervision. And so in the Adopters Welcome Manual, they do a really great job of outlining some potential alternatives to trying to encourage animal owners to keep their cats indoors. But ultimately, there are situations that won't happen. So there are situations where they'll take the cat home and they'll end up like letting it outside anyway. So I think that doing our best to approach it in an understanding manner, because this is something that, although us in the animal sheltering community say, oh, obviously we see all this research on both sides and we have our own opinions about it, this might not be something that a pet owner might understand or know even.
Mm-hmm. Exactly, and coming at it in an educational way versus a more respectful
for sure,
way,
yeah.
and just sharing the information as opposed
Mhm.
to enforcing it, saying absolutely not.
Mhm.
Um, okay, great. So one last question here. If anyone else has any final questions, we have about like a minute or so left after this one. But the last question says, what are age restrictions? I believe it might be age restrictions or barriers to adopting.
Yeah, I mentioned age restrictions. So There is I don't know what the reference is now, but there was a really interesting study in the UK that looked at the types of kind of adoption practices that are commonly practiced and whether or not they could potentially provide barriers. And there were quite a few animal shelters who posed a barrier that was a hard age restriction. So, for example, no people under 21 or 25 are allowed to adopt an animal. So that's what I mean when I say like an explicit age restriction. They're also a family related age restriction. So perhaps they might say you're not allowed to adopt from us if you have a child that's under 6, et cetera, et cetera. And so when I talk about age restrictions, I just mean the family members, restricting family members of certain ages from adopting animals.
Okay. And if there isn't any last questions, I think that's all for today. So yeah, I think with all of those great questions, we had a ton of investment with the group, and everyone asked some really great questions. And you did a great job answering them all. But if you feel like you still have some questions for Lexus, don't forget you can send her a private message. If you look under the attendees tab, you can look her up and find her that way. So if you want to keep an eye on the bell icon at the top right corner of your screen, you'll see a red dot if you have any notifications, for example, and that'll be a pending message that you need to reply to. So before we end this session, I'll give you the play to win code for this session. It's shelter013, and then it's also going to be put in the chat for you. We have a Grub and Groove lunch break, 45-minute break coming up on the PetSmart Charities Canada stage. Please join us right here on the event platform, or if you need a little break, you can get away from your screen and then come back to our next session at 1 p.m. Mountain Time. Before we break, please complete the survey session. You'll find it at the top left-hand side of the screen in the navigation menu. And then also during the break, don't forget to visit our exhibitor virtual booths and learn how their services can help you, and feel free to send them a message to connect. Lastly, please check out our virtual photo booth sponsored by Hills Pet Nutrition. We'll see you then, and thank you again, Lexus, for this wonderful presentation.
Thank you, everyone.